As parents age and need assistance, you want to know that they're safe and being taken care of properly. But how do you know your loved one is in safe hands? Well, joining me now is John Quinn, the president and CEO of VNA Health Systems, and Tanya Holland, the business director of CareSource. Welcome to both of you.
Thank you.
Thank you for having us, Jocelyn.
John, let's talk about the VNA and how has it evolved over the years?
Well, the VNA this year actually is 106 years old. And VNA Health Systems is actually the parent corporation of two very well-known services that we provide. One is Visiting Nurse Association of South Central Connecticut over at One Long Wharf, and also CareSource, which we're here about to talk about today. But in 104 years, we've actually progressed to the point where we used to be nurses who just went out in the field.
Exactly, that's what I envision, exactly.
And the technology wasn't that great, and now we're talking about some really high-tech services that we provide. That includes oncology care and also other services that are based upon the needs of our population. You're also seeing an awful lot of folks now who need services that weren't available in the past that we could provide for them, like wound care. So when they come out of the hospital, our nurses are ready to treat them right then and there.
Now, what's the relationship with CareSource?
Well, CareSource is actually one of our subsidiaries of the VNA Health Systems, and 16 years ago, this division was created because there's a basic need out there for services that are non-medically related. So we don't really have to have nurses out there in the field, but we need folks like caregivers and also folks who are doing companions and homemakers to actually work out in the field to take care of folks who no longer need the medical component.
So basically, Tanya, you provide short-term care?
Short-term and long-term. Again, CareSource is a non-medical private duty agency, and our professionally trained certified nurses aides, home health aides, homemakers, and companions can provide different types of services.
How are you different from other agencies?
Well, we're different in many ways. We're different, number one, because of our affiliation with the VNA. In the event that our clients need change, we are able to get the VNA involved right away. We pride ourselves on delivering excellent customer service. That's number one for us. And we're also able to provide in-home assessments at no additional charge to the client. We have a clinical coordinator on staff, and she's an RN. So she's always involved in all of the cases.
Now, when someone is looking for a service like yours, what should they keep in mind?
Well, it's really hard to tell. You know, what I would say is for them to give us a call, and that way we can kind of talk a little bit and find out what the need is. It's important for us to make sure we gather all of the information and then determine what that need will be.
This is really also, you talk about respite care, the importance of that for caregivers.
Yes, we do provide respite care, and that's for if someone feels like they need a vacation and they just can't get away, or maybe even a long weekend, we're able to provide that service as well.
Especially this time of the holidays coming upon us, that there's a lot of folks who have been taking care of their loved ones for so long, and it's an arduous task.
It is.
It's draining. And so we're here to say peace of mind, CareSource, come talk to us, and we'll tell you how we can help you, even if it's just a weekend getaway. Just something to relax yourself so that you can have the peace of mind you really need. That's what we're talking about.
How soon can someone get that help that they need? If they called today for something tonight, let's say, can they get somebody?
Oh, absolutely. Absolutely. If you call today and you need services to begin tonight, we're able to have our clinical coordinator go out to the home and, do the assessment to make sure that the services the client wants is appropriate for them. And after that, we're able to get the staff involved right away.
How are you able to do that?
Well, we have a CNA, which is a certified nurse's aide, and she is very flexible. She's called a floater. So that gives us the flexibility to open cases as quickly as possible, and that's really important to us.
John, you were going to say something?
Well, we also have to make sure that they really need the care that they're talking about, too, and because sometimes it might be more medically oriented, and that's where the VNA and CareSource tie ourselves together, that we can take care of those needs when they're not presented that way to the consumer, but they really need some medical care also, so we can actually work in combination to serve that client.
And as you said, this is a good time for people to really look at, see what they really need, and to look at agencies like yours.
Yes.
Well, the important thing about that too, Justin, is that the VNA has been around so long, and we actually have the original VNAs of New Haven, and also Milford and the Lower Valley. So with that reputation, I think that's where we stand out among others. There's plenty of places you can call. Look in the yellow pages, you'll see a lot. But are they as reliable and dedicated to the services like the VNA and CareSource?
Absolutely. And I want to talk about the special offer that you're extending this season.
Yes. And that offer is $25 off of your first full week of service. And we also have many other specials, and they can contact us at 203-891-8270 to find out more information about that. Or they can visit us on our website, which is caresourceinc.org.
And John, CareSource is, again, one of the most important programs that VNA provides.
Yes, it is. It's actually moved in now to our location of One Long Wharf. We want to make sure that we're even closer together.
You're all
in
together.
our service.
Yeah. It's a family.
It's important because when you're taking referrals and they're calling and they need a medical assistance, we're there for them for the VNA side,
Yes.
and vice versa. When the VNA is taking a referral and they really don't need medical care, CareSource is right here, folks.
Very good. And the information is right there for you on the screen right now. And if you want more, of course, come to our website and we'll have the link for you. Again, John, Tanya, thank you for being with us.
Thank you very much for having us.
Thank
You're
you, Chancellor.
welcome.
Thank you.
Don't go